Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them like a thunderclap. Today, we break down the Filoviridae, a family that causes severe hemorrhagic fever in humans. Challenge yourselves with these questions before we start. Which filovirus has a licensed vaccine available for prevention? Which one's linked to cancer development? Let's power on. Ebola and Marburg viruses are filamentous, enveloped, negative sense, single-stranded RNA viruses, and can show variable shapes. Being filamentous helps them evade immune detection and facilitate cell-to-cell spread. The envelope, derived from the host membrane, aids viral entry, but makes them sensitive to disinfectants. Negative sense RNA viruses carry their own RNA polymerase to produce a positive sense RNA copy before making viral proteins, unlike their positive sense counterparts. Ebola and Marburg viruses share similar virulence and transmission characteristics. Their glycoprotein causes vascular leakage, leading to hypotension and hemorrhage, while viral proteins like VP35, VP24, and VP40 help these viruses evade the host immune response. Both bugs spread through direct contact with body fluids, contaminated objects, or unsafe burials. People most at risk include healthcare workers, caregivers, and close contacts, especially in Central and East African regions. Outbreaks often start or spread in hospitals, so careful infection control and protective gear are essential to keep these viruses from spreading further. Ebola and Marburg viruses have an incubation period of 2 to 21 days, after which patients develop an abrupt high fever and severe malaise. This phase is followed by a gastrointestinal phase marked by vomiting, diarrhea, and abdominal pain, sometimes accompanied by rash and liver damage. As the disease progresses, bleeding from mucous membranes and skin can occur. Severe cases may develop hypovolemic shock, marked by severely low blood pressure, disseminated intravascular coagulation or DIC, and multi-organ failure. DIC is a critical condition in which severe inflammation triggers extensive use of platelets and clotting factors, resulting in continuous bleeding. Neither one's linked to cancer. The clinical presentation of both viruses is very similar, so it's hard to distinguish them based on symptoms alone. Differentiating Ebola from Marburg is important for tracking outbreaks, guiding vaccine use, and informing public health responses. The diagnosis of Ebola and Marburg viruses relies on laboratory tests such as reverse transcription polymerase chain reaction, antigen detection, and enzyme-linked immunosorbent assay for IgM and IgG antibodies. Treatment for both is mainly supportive, including fluids, electrolyte management, and symptom relief. For Ebola, monoclonal antibodies like Inmazeb and Ebanga are available, but Marburg has no approved antiviral therapy. Prevention focuses on strict infection control, the use of personal protective equipment, and safe burial practices. Additionally, a licensed Ebola vaccine can protect at-risk populations, but there's no vaccine for Marburg, making adherence to protective measures especially critical during outbreaks. Let's review. Which filovirus has a licensed vaccine available for prevention? Answer: Ebola. Which one's linked to cancer development? Answer: none. No wrongs? Galactic. If this clip taught you a hack or two, like, share, and click subscribe. Check the summary table in the description. Thanks for watching. Stay hooked on Med in 5 for rapid mini-med insights.